Everybody. I finished my first year of nursing school. Yay! I'm on summer break and I wanted to post a video and let you know just a few things I learned that helped me, maybe will help you. Hopefully you're on your journey into nursing school. If you haven't got in yet, be patient, you will. If you're already in, congratulations, and hope you're taking the summer off. So I just made a few notes because I wanted to focus on a couple of things that, like I said, that helped me through school. I stayed really organized. I used a day planner and planned out my time pretty well. I took one day off a week up until the last 4 weeks. Then it got pretty hectic and I was getting tired. So that one day a week really helps you rejuvenate. I took mini naps after school. That helped. And I learned how to put on my professional nurse's persona this year in clinical setting. When I'd enter the medical facility I was doing clinical duty at, I learned how to be nurse once I entered that facility, and it wasn't an easy lesson. You got to be on your toes. Remember, everyone is looking at you. Everyone is listening to you. And be mindful of HIPAA when you're talking to people around you. If you're not familiar with HIPAA, look it up. HIPAA. It's important. I gave injections this past semester, mostly heparin and insulin. Took blood sugars in the morning from some of my patients and administered PO meds. If you don't know what PO means, look it up. Learn your abbreviations because you're going to start writing progress notes on your patients, and you need that shorthand. It saves a lot of time. And you need to be able to read it in the doctor's notes in the charts at the hospital. So go online and look up abbreviations, medical, and start learning them now. I learned in sim lab. We have a simulation laboratory that is taught by a ER nurse, and I learned how to give a doorway assessment of my patient upon entering the room, how to quickly assess, are they in trouble, are they stable, and that's critical. And then I learned that the two most important things are airway, breathing, and fluids to keep the blood pressure up. So those are ER medicine terms or assessments that are done constantly. Airway and fluids. So that was a good way to kind of cut it down to the bare bones. So the first semester I did fundamentals of nursing in conjunction with pharmacology, and then the second semester was divided up into 8 weeks of medical surgical and 8 weeks of neurological orthopedic mobility and sensation class, which included spinal cord and head injuries, orthopedics, mainly knee and hip replacement, fractures, mobility, and cognition, which was kind of overlapped into neurology. So that was a good class to have. It was a lot of information, came at us really quickly, and it was a bit grueling, long tests, and but we all did okay. What else? Oh, learn SBAR, SBAR. It's how to communicate with a doctor or another colleague in the medical setting quickly, professionally, succinctly, and get the message across. SBAR stands for Situation, Background, Assessment, and Recommendation. You will learn it your first year of nursing, but read about it now and start practicing it. You can do it with your boyfriend or girlfriend or mom or dad or uncle or kids, and get proficient at it. You'll have to do it quickly in a medical setting and be on your toes at the same time, because it involves critical thinking and quick communication. So that's a tip from me. I hope you're having a great summer. I'm starting to relax. School's been out for 3 weeks, but I've had a lot of catch up to do with household things and chores, errands and stuff like that. So thanks for subscribing. Email me any questions you have. Ask me questions about nursing school or the TEAS exam. Or so anyway, next year I start off 8 weeks of labor and delivery, 8 weeks of psych, and then 8 weeks of cardiac, and then 8 weeks of leadership, and then I'm done and I graduate and study for my state licensing exam, and then hopefully get a job as a nurse. So love you guys. Congratulations wherever you are in your journey. Stay focused, stay positive. Don't worry about the future. You can plan, but remember to breathe and be in the moment and put on your professional hat when you're in a medical setting and at school and with your classmates. And don't forget to laugh, okay? See you soon.